In this video, we're going to be talking all about CBD. And I am so happy to be joined today by my friend and colleague, Dr. Smita Patel. Dr. Smita is a neurologist and sleep specialist. Thanks, Smita, for joining me today.
Thank you so much, Nishi. I'm so excited to be here and do this little piece.
I'm really excited about this as well because this is something that people ask me about all the time. I get questions about CBD frequently. So I'm really excited to learn from you and to share this knowledge with our audience. So before we jump in, could you just give us a little bit of background about yourself and why you're so interested in sleep?
Yeah, so I guess I am a integrative neurologist and sleep medicine physician. And given my studies of neurology, sleep medicine, and integrative medicine, I really try to provide resources so any of us at any age can really take this information and optimize our brain health. And so I try to provide that scientific, evidence-based type of information, either via natural medicines, sleep medicine, food, and just try to intertwine it to kind of give personal recommendations. So that's a little bit of my background. Why did I get into sleep medicine? I don't think I was a really good sleeper. And I think it didn't really hit me until I was in medical school. And I didn't realize that, there's just lack of time, I think, so it's like, okay, I really have no time to nap or sleep or anything. And so then I'm like stuck drinking caffeine to try to keep me awake. And so I was drinking caffeine during the day. I'm trying to drink caffeine at night when I'm trying to get some studying done. And it was just like I'm kind of like a zombie. So I was definitely in a bad cycle, and I didn't feel good either. So it wasn't until like my fourth year in medical school, I think, when I like just realized like I'm just gonna go to sleep. I can't take it anymore, and then I'll just wake up early in the morning. And then I actually started feeling better with that following my circadian rhythm and that process. And so it took that long for me to realize it and my own self, but then I also see it in my patients. So in residency, I was seeing that patients who slept better, tended to have better health conditions as well too. So they when they improved that, they kind of improved their problem, their migraines got better, for example. So that's how I came around to kind of wanting to study sleep in more detail.
It's so interesting to hear that because my interest in sleep sort of came about in a similar way where I really struggled in residency with sleep deprivation. And, I experienced the same kind of thing firsthand, using a lot of caffeine or trying to find different ways to catch up, and it just didn't feel good. And then I saw my patients also struggling with sleep, and the ones who slept better had less depression and anxiety in the psychiatric clinic. So it's so interesting to hear the parallels with your experience as well. You're a neurologist, and so I know you speak a lot about brain health and keeping your brain healthy as we age. How is sleep specifically relevant to a healthy brain and also to help prevent age-related decline in brain health?
Yeah, that's a fascinating topic because I think we just started learning about the connection of brain and Alzheimer's dementia, for example. So we can probably blame about 15% of Alzheimer's dementia on sleep problems. And what's the mechanism, right? So it was a mystery for such a long time. And we may have finally found some of the answers just with scientists kind of discovering this. So they're looking at, how we get rid of toxins. And we know that in our body, just cellular action, there's metabolism, and then there's end products and toxins that come out as a result of that. And our body, the lymphatic system, kind of takes that over and clears it for us. But in the brain, they were saying, well, what's happening there? It's such a closed system. They thought that, blood-brain barrier, nothing can go in, nothing can come out. So how does the brain, such an active organ, take care of its waste? And so it turns out that they were studying mice, and they saw mice sleeping in their deepest sleep. And during this time, they saw that cells were shrinking, and then there was space in the fluid where that fluid was then kind of going out into the lymphatic system. And so this washing out, when they looked at the fluid, they under a microscope, they actually saw proteins of things like amyloid, tau, and another thing called alpha-synuclein, which is often found in patients with Parkinson's disease and Lewy body dementia. So since then, they've done studies on humans, and we know that there's this cleaning system, and it's ramped up when we sleep. It's kind of not active when we're awake. So, it's might this be a connection of poor sleep and Alzheimer's disease, that if we're not getting good sleep, then, that you're putting your brain at more risk for accumulating these toxins, these proteins, and not being able to clear them. So in our brain, we call this the glymphatic system, and it's this washing and cleaning system of our brain. And I think, that's where sleep is relevant to our brain health.
And it's been really interesting to see some of these studies coming out showing how this system is very active during the stage 3 deep stage of sleep, and how you see the synchronization of kind of brain activity that kind of really does wash out a lot of these proteins that lead to Alzheimer's dementia, as you mentioned, or Parkinsonism. So let's jump into...
Let me add one more thing, is that two studies kind of come to mind when I think about this, is that they were looking at patients' sleep, and they kept two groups. They had one group who just stayed awake, and they kind of made them stay awake, so like total sleep deprivation. And then they had another group who they did allow them to sleep. They put headphones on, and every time they got into like a stage 3 sleep, that deep sleep, they would kind of wake them up with these noises. And so this disrupted sleep that they had throughout the night. And when they looked at amyloid in their brains, they found that, it didn't really matter whether you had total sleep deprivation or partial sleep deprivation. The amyloid continued to be there. So, my little tip is that if you're tired, or, you think you have sleep apnea, because sleep apnea kind of disrupts your sleep, you should consider getting it checked out, because, either way, it's not a good thing.
That's exactly right. And that really speaks to the importance of sleep continuity and having a regular sleep schedule. And so let's talk a little bit about CBD and maybe what role that might play in sleep. Could that be helpful with brain health also? So maybe we can start by just first talking about what CBD is. What is CBD? How is it different from THC? And maybe you could speak to that a bit.
Yeah, so cannabinoids are abundant compounds within the cannabis plant. And so they're found within the human body as well. And they have a wide range of activities. The two most studied cannabinoids are the THC and CBD. But there are other cannabinoids like CBN, CBC, CBGA. And like for the purpose of this segment, I think we should focus on CBD and THC. But, I think the whole plant is something of great value, and we can, break it down into probably 500 different compounds. I'm not sure exactly what that number is, but I think there's a lot to be studied there, and so right now we're, like I said, focusing on the CBD THC, and the best way I think I can summarize that is that THC seems to be a little more psychoactive, while CBD is not. And so CBD, maybe it can have some impact, can make you more stimulated, or if you take too much, can make you sleepy. But that's how I like to kind of differentiate the two.
And could you explain a little bit more about that to our audience who may not understand what the differences are in terms of the effects and what does psychoactive mean? So practically, if someone's taking THC versus CBD, what might they expect in terms of, how it might affect their emotional state, or their cognition, or their levels of alertness?
Yeah, so as I said, CBD can be a little more stimulating, and so maybe even that might be kind of good, just to try to help you kind of get through the morning or the day. But at night, you might want to be, a little more sedate. And so, and that's where I think the THC part of it can come in, is kind of using proper ratios. And I'm not definitely an expert on what these ratios are. Unfortunately, it's just not studied so well. But if we can kind of know what we know from self-reports and things, that THC can be a little more sedating, and so therefore mixed with CBD can maybe help with that sleep part, if we're talking about that. And then THC, as I said, is kind of a little more psychoactive, so people can maybe get like especially in high doses, might feel more of an anxiety or heart racing, kind of euphoria type of feeling, or even maybe paranoid feeling.
Yes, and I think that's really important to remember, is that this is a medicine to be used in the right way. And because it is natural and plant-based, it doesn't mean that it is safe at all doses or safe for everybody. So how does CBD help with sleep? And are there certain sleep disorders that it is better for? Are there certain disorders that it doesn't really help with? What does the research show about this?
First of all, unfortunately, there's just minimal data overall for on sleep, because it's illegal federally. So, California was the first state to kind of power through the federal ban, and then since then, other states on an individual basis can decide if they want to legalize it or not. And so, if cannabis can be changed from Schedule 1, which kind of means that there's no medicine value and it's a high risk for abuse, to more of something like Schedule 2, which does have medicine value, then, this would encourage and allow more scientists to investigate the safety and the potential benefits for sure. But right now, as I mentioned before, we have mostly self-reported data on sleep. And so what I could say is that it does seem to help, short term from what we do know. Longer term, it may not be a good practice, especially if you, have insomnia and not following good sleep hygiene and things like this. But from what I can tell you is that, the THC part may help decrease your sleep latency. So it might help you fall asleep faster. It might also, unfortunately, impact the amount of REM sleep you have. So that's our dream sleep. And so, we want to continue to have that, but it might decrease the amount of REM sleep that someone gets. It might even decrease the stage 3 sleep. So, so I think there's still a lot to learn, but that's kind of what preliminary data seems to show, that how it impacts our sleep. And unfortunately, the other thing is that it can have a little bit of habituating effect. So it's not like you're addicted to it, but you might end up having a tolerance to the dose that you take, especially if you're looking to take this long term. So we have to decide, is it better to increase the dose, or is it actually better to decrease the dose in those instances? So right now it seems like, maybe it would be better to decrease the dose if you've gotten to that habituating effect of it, and kind of wean down on it to try to help open up the receptors. We don't want to talk so much science, but that's the thought process of how the mechanism might work.
Right.
I didn't answer the second part. Sorry about that. So the second part to your question was, what other sleep disorders? We have some research on cannabis being used for sleep apnea, for example. But unfortunately, we don't have enough research. It's not enough to say that it made a meaningful difference in treating sleep apnea with synthetic cannabis. And so also the same kind of information goes for restless legs and REM behavior disorder. But I think, again, that there's probably some potential benefit in these other disorders for sleep. It's just what we need more science.
Absolutely. And I look forward to a time where we do have more research and kind of more clinical guidance on, how to use CBD or combinations of CBD and THC medicinally, and to really understand what are the optimal doses and ratios. And, something you said is really important, which is that, it may be useful short term in conjunction with behavioral approaches. So maintaining good sleep hygiene and good sleep practices. And something I see a lot with my patients in my practice is when they're using THC continually, they do get that REM suppression, as you mentioned. And when they stop, they get REM rebound. And so they get these really vivid and crazy dreams that can often be somewhat disturbing emotionally, and also disturbing to their sleep. So that's another thing that I think people should keep in mind, is that there are immediate effects on sleep, but there are also other things that can happen longer term, or even when you stop these compounds.
And I would just want to say that I mean, again, if you're looking at a short-term fix, we can probably say, that, you had an acute stressor, and we, you want to try something to just try to help kind of take the edge off. It might be better than a pharmaceutical medication, just because, minimal side effects in that regard. Hopefully, you're not on a bunch of other medications. That's kind of my next thing that I want to bring up, but I'll let you go ahead and interject there.
Yeah, no, absolutely. So, well, let's go ahead and talk about that. What are, some side effects and interactions to look out for if you are taking other medications or even other supplements? What are some things that people should be aware of?
Yeah, so cannabis is metabolized by the liver, so by our cytochrome P450 system. And so other drugs that use that same pathway, you can have a drug interaction. And so people who take warfarin, for example, Coumadin, may not be able to take cannabis because of these drug interactions. It interacts with levothyroxine, a thyroid medication commonly used for people who have hypothyroidism. And so other neurological drugs, for example, people who are on anti-seizure medications for a variety of reasons, they might be trying to use it as a preventative for migraines, or they might have seizures, or whatnot. So I think that we do have to kind of keep that in mind when we recommend cannabis. So we're not prescribing it, but we are, certainly can recommend it as a doctor. And so other side effects that commonly can occur, is sedation. And that might be something that someone's trying for, specifically when they're trying to go to sleep. But, I think the other thing, though, is that we think CBD, like there's CBD alone, and then there's CBD with THC. And often we think, CBD is probably well tolerated, but it can also have some side effects, like dry mouth, diarrhea, reduced appetite, and then the drowsiness and fatigue, of course. And then the THC, if used in high doses, we talked about it maybe having experience with anxiety, psychosis. There's also like heart attacks reported and irregular heart rhythms. So it's not completely side effect free, but it seems to have, like, again, for a short term, maybe a little better side effect profile than some of the prescription medications, like opioids, for example. It wouldn't have such an addicting effect. Also, I think we have to remember how we take this, edible versus smoking. And I think that those routes of administration also kind of have different side effect profile, if you will. So inhaling does seem to cause breathing problems, wheezing, coughing as the initial things, but also can lead to pneumonia and bronchitis. So something to remember and take that into account when we're recommending cannabis.
That's a really important reminder to recognize that the route of administration can also cause its own side effects, not from the drug itself, but just also how you're taking it. And, so I'm in California. There's CBD everywhere here. Like, even if you go to your local coffee shop, you can get a shot of CBD added to your morning coffee. And my dog is actually on CBD right now for anxiety. and working really well for him. And so, there are a lot of benefits, but, because it is so readily available in certain places, like here in California, it's hard to know what's good quality and what isn't. So how does somebody know if they're getting it from a reputable source and if the CBD that they're taking is of good quality?
Yeah, I mean, again, I think it's hard to know because we don't have a lot of science in this, but I would probably recommend my patients to go to a dispensary because at least it's more quality control versus something online. You don't know where it came from, and so I think going to a dispensary would probably be my recommendation and advice.
Dr. Smita, this is just so interesting, and I really appreciate you sharing all of this knowledge with our audience today. What are some general takeaways that you want people to get out of this conversation?
So I think while doctors may not know all the benefits, they do know some of the potentially serious drug interactions with CBD. Like we talked about some of the drugs. I think that's common knowledge. Some of the downsides of cannabis can be the psychoactivity. So instead of feeling mildly euphoric and experiencing less pain or nausea, you can become groggy, anxious, or paranoid. And a possible downside, I think we need to remember smoking, can have that problem. And I didn't mention that edibles, we think again could be easier to ingest but the absorption, the onset could be delayed and the dosing can therefore be less predictable. So with edible products, they may have more of a profound and prolonged psychoactive effect compared to inhalation. But again, I think that's what I generally want people to kind of take away is how are you taking it? What's the dose? Those are things that need to be slowly experimented with until we have better scientific knowledge of how we should be dispensing it.
I think that's really important to remember is that, we still don't have good clinical guidelines on dosing or even on what formulations are appropriate for specific conditions. There is some research, I believe, in epilepsy, and there's a product that is used for that. And you're a neurologist, so you can probably speak more about that. But, for the physicians out there, I know this is a very controversial topic, at least in my field of psychiatry and in medicine in general. So what are some general tips or takeaways that you would want to share with physicians or healthcare professionals who might be listening today?
So I think a tip for doctors or healthcare professionals is, first of all, it's important to understand that cannabis is not something you prescribe, but only recommended for a patient. So keep that in mind. I think the other thing is that, dosing, as we talked about, is very different than dosing for pharmaceuticals. And since cannabis contains more than one active ingredient, the dosing requires attention to the ratios of CBD and THC and the timing of administration, along with the route of administration. And I think I also want to say that, I think the general consumer should want to talk to their doctor because, while doctors don't know everything, I think they want to learn. And then, so therefore, you shouldn't be scared to tell your doctor, and that patient-doctor relationships should really be there to help guide treatment. So as a doctor, again, I would say it's not easy to speak on dosing given that, but start low and go slow. And cannabis recommendations will definitely need to be individualized.
Absolutely. And that's also a really important point about having that conversation. So for patients, to open up that dialogue with your physician. And I love how you said that, don't be afraid of bringing it up with your doctor. Your doctor is not going to know everything. We don't know everything, but we are open to learning. And on the flip side, I think it's important that physicians and healthcare professionals ask their patients about this too, because people are taking this stuff and you might not realize it. And there may be interactions that are happening behind the scenes that you should be, aware of. So, yep, I love that. And yeah, I would encourage physicians to really start asking their patients whether or not they're taking CBD, I've had people come into my office and open up their purse and show me different tinctures and vials that they got from their friends or their neighbor in various places. And I really appreciate the patient for sharing that with me. And also for physicians to ask their patients about supplements that they're taking. I'll just make that little plug because
I totally agree. Unless you ask, you don't get to know that. And they either don't feel like you should know, you don't know anything about it, you're just going to make me feel bad or, whatnot. But yeah, absolutely. So I wish we could have that more open discussion.
And we are going to be hosting a workshop where it's not going to be about CBD specifically, but we're going to be talking about sleep. Could you share some about that?
Yes, so I'm super excited that Sleep Divas will be having this free workshop on sleep. So you'll get to be part of this intimate conversation with 4 sleep professionals. Sleep is disturbed or you have questions about sleep, you'll want to sign up for this free workshop for sure. It's on November 10. And in the meantime, you can sign up on our wait list.
Excellent. And I'm really excited about our workshops. It's going to be you, me, Dr. Val, and Amanda. We're all sleep specialists. And yeah, we're really looking forward to it. So November 10th, the link will be on the screen here and then under the video. Dr. Smita,
everyone needs good sleep.
Much. Yes, everybody needs to sleep. Even us doctors, we need to sleep too. So yeah, and it's one of our favorite topics. I know that we could just keep on talking about all day. So thank you, Dr. Smita, for being here today and for sharing this information about CBD. I really appreciate your time.
Thank you. Thanks for having me. This has been great.